Welcome to the Health and Education Committee meeting for March 2013. Good to see everyone here. First order of business, of course, is the approval of the minutes, and I need a motion to do that.
So move.
Second.
Commissioner Soriano and Commissioner Cookburg. And all in favor, please say aye.
Aye.
Aye. And thank you. And we're off to a running start here. Community care report. Ms. Cook, you are on your own tonight. How long have you been a member of the
Community care?
Yeah, community care?
Longer than I had fingers.
Okay.
I don't know.
Well, is there any problem with community care that this committee needs to know about? And there never is, because it's terrific, but I don't want to put words in your mouth, so whatever you say.
We're doing fine out there. Everything's going well.
Okay, the community care report, of course, is on your iPod there, Commissioners, and you've had a chance to look it over pre-meeting. And if there are no questions, Mr. Mayor, any comment to make on community care at all?
Well, since this is low soft in all of our nursing homes across the state now, because they're providing some additional care at home that they hadn't been doing earlier, so that program is having a little bit of impact on the total census, but otherwise they're doing good.
Questions from anyone? If not, need a motion to approve.
Motion to approve the report.
Commissioner Jordan, thank you. A second.
Second.
Commissioner Phillips, thank you. All in favor? If there are no questions, please say aye.
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 We still invite you all out to view the building.
Okay. You've been invited out to the building. It is a beautiful facility, too. Ms. Garrett, will you come up, please?
Yes, sir.
Ms. Garrett's got all kinds of information. As you know, she wasn't with us last month, and she has January and February report, which are you've also been given a copy of the committee, and we have evidently Mr. Burgess is sponsoring a walk.
Yes.
We all, listen, all of you are invited as well.
Yes,
We want
of course.
A lot of participation from.
Yes, I'm going to go in depth about it and tell you all about it.
Well, wherever you'd like to start with
Okay.
January report if you want to, and
Okay.
we'll get up to date here.
All right. Again, sorry I was absent last month. January's report I did send in to you all as well last month, but I just wanted to have it here in case you had any questions or anything. It's right where we would expect to be this early in the year with our patient encounters. It looks very normal to where we were last year. We continue to see a very big increases in our Smyrna site, which we would expect. And we're actually getting some more staff that are going to be staffed up in the Smyrna site to try to handle the increases. So we're excited about the expansion that's happening there. And then, of course, Murfreesboro is maintaining right along where we should be. Immunization numbers are right where they should be. They're coming down a little bit because flu season, we always see that high spike, towards the end of the year and the beginning. But now we'll start to see the numbers come down a little bit.
Questions from Ms. Garrett about January report? I think we'll take them separately and just have a separate vote
Yes,
on them. But any questions on January from the committee?
The other thing I have, Dana, is
Yes.
on women's health, family planning, and breastfeeding, those both are, all three of those are down over February of 12. And those are all, women-related issues. I'm just curious, is there anything you can tie that to? I mean, are there additional services being offered they're seeking elsewhere, or?
Well, you'll see that in some of those programs let me look, are you on February?
On February.
Yeah. We'll see those seasonally decrease. We also see that with family planning, a lot more young women are on their family's insurance now with law changes that have occurred.
Okay.
So they're not necessarily needing that service as much. So I'm kind of watching that to see with the family planning especially where our numbers go and what we could do to possibly outreach if we need to or redesign. But I'm just kind of watching it because it's still a new kind of process.
Right.
But yes, you're exactly right.
Do you think we'll continue to see that in other areas because of the changes in healthcare, the different healthcare mandates? Or
Yeah,
do you anticipate other changes
yeah.
here?
it's kind of hard to, I've been thinking about it as the new laws come out, and the state has tried, they have a council together where they're trying to kind of look at these things and see how it will impact. But it's just so ever-changing right now. I'm just kind of rolling with it to see where it goes.
Is there any way for you to compare where we are to other counties, other states, to see if it's kind of an industry-wide hit?
Yes, I do look at those. I get those comparisons for the county that's kind of close to us and similar in is Montgomery as far as size. And it's not really, but it's the closest one I have that's near that I can sort of tell. And they've kind of seen similar
Trends.
dips. Yeah. They also have the military base there, so sometimes that will affect their numbers. So it's just difficult to say at this point. But it is something, that's why I look at this every month and kind of monitor it to see where we're going.
Thanks.
The breastfeeding numbers, I think that's just seasonal, so that comes, that'll increase again. And matter of fact, it's such a important thing to the state that they've given us a full-time and a part-time peer counselor that will be working with women in the community, in their homes, at the health department with breastfeeding, trying to increase
I know
that.
it's seasonal, but these are February numbers compared to February numbers.
Right,
you know?
right,
And
exactly.
it's all three of those are down in Murfreesboro and Smyrna.
Yeah,
So-
yeah. For the breastfeeding, yes.
Well, all three of those,
Yeah.
the family planning, breastfeeding, and women's health.
Right. Yeah, when I said that about the
Yeah.
seasonal, I was just talking about the breastfeeding.
Yeah.
The other two, I think, are directly related to the fact that some
Coverage
women are now on coverage that wasn't available before. So,
Committee, since Commissioner Allen's question was on February, if you want to look at February, we'll just go ahead and take them together, which is exactly opposite what I just said a minute ago. I think we can do that. If you look at February, which is also on your iPad, of course.
See, our dental numbers are 0. I guess we're still
Yes.
looking for a dentist.
yeah, we are. I actually have an interview tomorrow with a candidate, so I'm hopeful. So we've interviewed a couple, and the state's looking at even maybe increasing the salary a little to try to help, which would be very helpful.
I think you've covered that before, but I know you have, but refresh my memory, is that dentist full-time?
It is a
position?
full-time position, but, I'll take part-time. If somebody wants to do a couple days a week, we'll work with that. But it is a full-time position with the benefits and everything. It is one of the county positions that the state reimburses for. So that's why I've been talking with the state about trying to increase the salary. And hopefully that would get us more candidates and maybe entice them to stay a little longer.
Have you worked with Sonia Stevenson to help with any kind of recruiting, or I'm just curious what other?
Well, yeah, she does a lot. Are you talking about our HR, Sonia? Yes, she's sent it out to a couple of places, but the big person that I've been working with is the dental school in Nashville, and they've really been, the last few people that I have interviewed have come from them that are right out of school. But yeah, if you have any ideas like that where I could send it out or promote it, please tell me, and I'll be glad to do it and interview with them.
Most young dentists, from what I hear, when they get out of school, have such great student debt. They have to get a pretty
Yes.
good paying job just to get out from under the debt
And
they're under.
unfortunately, the federal government does not consider us an area where there's a high need for dentists, and so they can't get their loans repaid in Rutherford County. Now, some counties, Stewart County and our Mid-Cumberland regional area is the only health department that is considered an underserved area by that federal. So that's kind of also, if we could get that, like loan repayment, I think would be a great,
That'd be
yes,
the
because
same
it
as
is.
a significant increase in pay.
Exactly, because it is a big concern when they come out of school. And so they'll usually stay with us, 6 months or a year as they get ready to go out and do their own private practice.
Seems like it would be an ideal job for a retiring dentist who wants basically a, semi-time practice. Because you said you'd work with them on schedule.
Oh, yeah,
They
absolutely.
could give as much time as they
1 or
need.
2 days is better than no days. I'd
Sure.
rather have it running some than none, but I haven't had any interest. 1 day a week would be difficult to do, but if we could do 2 days a week, or even a couple hours in the morning, or whatever, we're flexible to
Right.
adjust the schedules to their needs. And we do some great programs with the schools, with the kids. And we're still doing those because those are done through the dental hygienist. So we're still able to do those. There's a few programs through the schools where they actually transport the kids to our facility that maybe don't have a chance to get to a dentist or whatever, that have been identified and their parents have okayed it. Then they come to our facility and they have dental services done when we have a dentist. So
What
that's
is-
one of the, it's called school transport. I really want to get that going again.
What is the salary that we're offering for that position?
82,000. It's posted right now on the HR's open position. So if anybody's interested, they can click on that and it tells you the salary. I called the county surrounding and we're just a slightly lower than the county surrounding us dentists. So that's why I've been talking to the,
Is it on TV too, that position? I haven't seen it, but I didn't mean it's not there.
Not on TV.
It is.
On Channel 19?
We posted on
For the-
TV? I'm not sure.
Rutherford County?
I don't know, that's a good,
I've
good
seen
question.
it is.
Oh, wait, okay.
It is?
Okay.
Okay.
I assumed that
post,
Sonia did, but
I see every now and then the animals, that
Yeah.
paws
Right,
and things
yeah.
like that. but
Right.
I would guess it'd be rotating on that, but.
yeah.
Well, maybe this meeting will scare up someone.
Yeah, that's right. Oh,
I kind of agree. It seemed like that person would be out there.
yeah,
I
yeah.
mean,
And in the past, we have found retiring dentists or new dentists who've worked great and done wonderful work for us. It just, not everlasting.
How about Interfit?
Yeah.
Interfit Dental Clinic, do they have any?
Yes, I've been talking with Rhonda. She's the director at Interfaith Dental, and she's helped us do the school transport program while in the midst, while we haven't had a dentist. And her and I have partnered quite a bit trying to figure out, but she doesn't have anybody either to refer to us. And, we interviewed a lady not too long ago who was just not interested in seeing any adults at all. And she just wanted to see children, and she only wanted to do well children, no real disease process. So, we have some candidates who come and interview, but not necessarily a match of what we need
Right.
in our health department. We really need someone who can see adults and children and focus on getting them back to well again.
Motion to
Further
approve.
questions? I'm sorry.
I was gonna say motion to approve both reports.
Second.
Mr. Jordan and Mr. Allen has seconded. Any further questions, discussion? If none, all in favor, please say aye.
Aye.
Opposed, and there is none. Ms. Garrett, you have, I don't think this requires us to do anything, and I'm awfully good at that, but we do have a Rutherford County Wellness Council Mayor's Walk. So we need info. We've heard about this now, and you're following through. So you
Yes.
said March or April, and my
Yeah.
God, it says April.
So I've been talking to you the last couple of months that I've been here about this Rutherford County Wellness, the health department, several different programs are pulling together to kind of pull off the Mayor's Walk. Mayor Burgess, Mayor Bragg are helping us sponsor down here in Murfreesboro. When we go to Smyrna and Laverne, the mayors there are going to help us, as well as Mayor Burgess. And so what we're trying to do is address that we have a lot of great locations in Rutherford County for walking, and we want to let people know where those are and meet their elected official, maybe their commissioners and their mayors, and just get out in the community and also increase activity. We know that from some statistical data that was just recently released, 27% of our residents are physically inactive, none at all. 30% are obese, and another 30% are overweight, so that's around 60%. So I just feel like it's, Mayor Burgess and I talked about how could we address this, and just getting out and having some fun and doing some fun walks. They're just 1 mile. They're free. The first one starts April 6th at Oakland Park. The second one is April 13th, and we'll do 2 that day, one at McKnight Park, one at Siegel Park. The McKnight one at 8 a.m. and the Siegel one at 11. And Saturday, April 20th, we're doing General Bragg Trailhead at 8 o'clock, and then the Discovery Center at 11. And Saturday, April 27th, Rogers Park at 8 a.m. and Patterson at 11. And then what our plan is to expand so that we have some walking in every single one of your districts. That's our plan, to be able to do that over the next couple of years. We really don't want to do it in the summer months. It'll be a little bit harder with so much softball and baseball and everything that's going on, so we thought we'd try to target like spring and fall and kind of outreach during those times. So more to come about these, but this is the first batch, first round, and I'd love to see you guys there. If you can make it to any of them or all of them, that would be great. Or if you know of, we've sent them out to local churches in these areas. That's on lots of websites. It's on our website, Rutherford County Government, and also on our Facebook page, Rutherford County Government Facebook page, for follow-up. If it happens to rain, just check the Rutherford County Government's webpage. That's where we'll put if it's canceled or not. April, we may get some rainstorms on those Saturdays. We'll pray not, but we may. And I really appreciate all of your guidance, and Mayor Burgess for willing to do this with us and get out and show our community that no matter what, we can all get out and walk. It's just mile, it's free, it's easy, and these are great available spots that are open all the time for us to enjoy.
Okay, April 6th, kickoff celebration, Oakland Park, 8 o'clock in the morning.
Yes.
That's the first one, and
Yes, sir.
just to review, everyone in the county is invited.
Yes, everyone. We're having competitions with the schools to see what school turns out the most children, and some other little fun competitions.
So will you have a
there should
check-in
be.
to keep up with it?
Yeah,
Okay.
there's someone there from the schools that's keeping up with it. We have a whole bunch of people. The fire truck's going to be there teaching about fire safety, and police will be there to help with things, and then the ambulance service is going to be there teaching and doing some car seat safeties, I think. The mobile health unit from MTMC, Middle Tennessee Medical Center, they'll be coming doing blood pressure screenings, those kinds of things. And they're also giving out some little free gifts and stuff. So I think it'll be fun. Oakland's the first one that people are going to dress in their period dress and walk with us. And so that'll be fun.
The mayor going to be a Minuteman or something?
We're not in period dress.
Oh.
They are.
Is this all on the website? I know we don't have a commission meeting before the 6th. It's the 11th, so we can't say anything in the commission meeting about it. Is this on the website?
Yes. And I've been working on a letter to email out to all the commissioners, just a little summary of it and telling them where and all that. So that probably will be coming out soon.
And my
It's kind of
district-
all coming together quickly.
My district is City Hall, so we'll meet at City Hall.
Yeah, there you go. There you go.
If the commissioners that are here, if you all could remember to just mention this at the committee that you are on, other committees that meet before the 6th, and I'll try to remember to do it at steering as well, which I believe is the first.
Yeah, and I will email it out right kind of close so that everybody can get one too, all the other commissioners who aren't on this board.
Not so much for the commission, that's important enough, but there's a lot of citizens that watch these meetings, and
Yeah,
maybe we can get
absolutely.
some further participation. Okay.
Anything you want to add to that, Mayor Burgess?
He's buying his tennis shoes, he's ready to go.
She and her whole team of supporters over there from her group at the health department came over, and it's their idea. I think it's a great idea, and it's a wonderful approach to start healthy activities.
Thank you.
Good job.
Did you get the T-shirt?
Well, we're working on that. So I won't promise yet, but.
Do you have an extra one of those?
Oh, yes, I do. Yeah. A few more if anybody needs them. And I just have one more update too, if I can.
Certainly.
One more second of your time. Some exciting news came out since we last met. Last year, if you all remember, ever since 2010, they've been ranking our counties on the health level of our county. And so it's done by a federal project through the Robert Wood Johnson Foundation and Wisconsin University. And every year we've been 3 out of the 95 counties. We've been 3rd, which is very good. This past year we went up to number 2. So we're now the 2nd healthiest county in the state of Tennessee, which is really, really exciting.
That's good.
And What, sir?
Who's in?
Williamson.
Williamson County is the
Oh,
first.
Williams.
Yeah, yeah. I
We
called
opened
their.
a donut shop in Williamson County.
I called their director and said, "Oh, we're nipping at your heels. We're right there. We're right there." So I just was going to tell you a few of the data points. There was a lot of data points that they look at, but mortality, which is death, premature death, we had a lot lower cases of that from our last year's survey, and that's meaning if people die before age 75, we had a lot less of that. Morbidity, so sicknesses and illnesses, the things they looked at there, we stayed about the same, but poor or fair health days reported by people when they were surveyed, that number went down, so that's good. Health factors that they looked at, adult smoking, which I'm really excited about this, it went down, which is awesome. Adult obesity, physical inactivity, excessive drinking, those are all categories they look at. We stayed the same in those categories, so that's good. We didn't go down, we didn't go up. Motor vehicle crash death rates, so we went down in those, in that area as well, which is awesome. They also looked at clinical care, like how many doctors are in the county, how many dentists are in the county per resident. And that's that's a new data point that they didn't look at last year, so it's hard to compare. But we can compare ourselves with Tennessee, and then we can compare ourselves with the national benchmark. And so if you want to look at this report, anybody on the TV, or if you guys, it's countyhealthrankings.org. And it's just some interesting information. We looked to see how many diabetics had been screened appropriately, and that was 86%, which is really good. We looked at mammograms, how many women who were in this certain age group had their mammogram, and it had gone up since last year. High school graduation rates had gone up. All this kind of stuff actually ties into health, which a lot of people may not understand, but the socioeconomic factors that do tie in. People who had some college, that number went up from the year before. Unemployment went down, which was good. Children in poverty, that level went down as well. Violent crime rate went down. All of these that they looked at. Safe drinking water was good, and we had a 0%, meaning there was no incidents of not safe drinking water in our county. They did recommend that we have less fast food restaurants. We have quite a few fast food restaurants, and we're very high there. The benchmark is 27%. We had 52%, and also more access to healthy foods. They looked at persons with lower income and how close they were to grocery stores, and there was some disparity there in our county that was a little bit lower, but again, a new statistic, so we don't have anything to compare it to. But I just thought just to hit the high points of that report and kind of tell you that we're doing good. And
That's good.
I think that has to do a lot with the support that we get from many good partnerships in this community.
Any other questions for Ms. Garrett? Okay, thank you for your information. I don't believe the mayor's walk requires any vote, so thank you, Ms. Garrett. We appreciate it.
Thanks.
Thank you.
And we'll see you on the 6th.
I messed it up for your report. Sorry. Oh, no. Here, we'll just move this one. This one will work. Come on over.
Ms. Jolly, come on up, please. School building program status report, projects report.
Do you need this? Do you need this one back? Or you?
I got hers.
I only have one change. I'll hand it back to you.
Ms. Jolly, welcome. What do you have for us?
Well, the only thing really that I was going to point out, when I did my report, the construction complete, and we ended up getting a bill in after I sent you the report, and so now it's 86.4% complete, and I don't know what I had on the report.
That's great.
Uh-huh.
79,
79,
32.
You're on page 1. The
Yeah.
79 goes to 86.
Mhm.
Boy, I'll tell you what.
Well, it'll be well within our projected timeline of opening on time, I
Yeah,
guess.
they're sneaking up on complete, aren't they?
Because I think some of the staffing gets in around July, June.
soon as we get possession of the building,
Okay.
or some part of it.
I've got it on here now. Okay,
We've had this report for about a week, so, committee, you're not saying anything, so I assume you have no questions, but if you have some, this would be a good time to voice them. If not, I need a motion to approve Ms. Challis' report.
Motion to approve the report.
Thank you,
Second.
Commissioner Attorney. A second from someone. Who was that?
Commissioner Sereno.
Commissioner Sereno, okay. If there are no questions, discussion, all in favor, please say aye.
Aye.
Aye, and opposed, there is none. Ms. Jolly, thank you. Sandvik, you can come up and face the music alone, it looks like. Your boss is not here. We have a work session this evening, I understand, the school board. I wasn't aware of that.
I don't find anything on here. No, there's nothing.
I don't believe you have any amendments, do you?
No, sir.
Oh.
I started working on that file today. Don't worry, they're coming.
I have a question here on, $155,290 left in the Eagleville addition. Do we have some unpaid bills? Do you know?
We still have some
No.
items that could eat into that. My last conversation with Mr. Clardy, I'm thinking we should have maybe 100,000 left in that project to apply to, redivide the money between elementary and secondary, and then apply it to the Smyrna primary design.
That was my next
middle
comment.
academics. And that's any savings that we also have at Stewart's Creek High, we'll do that same.
Okay.
That just about covered the 100,000 would, I'm pretty close to covering the design fee, wouldn't it?
Our hope was we would be able to cover both design fees. Don't get too excited about the construction costs. But we won't be able to cover all of the architect's fees, but we think we can cover the design portion alone with that internal funding.
Okay.
And do you want me to?
Well, Mr. Sandvik is here, obviously, to discuss BEP money and possibilities, what we know, if we have any fresh information since our last meeting.
We don't have much fresh information. One of the things that we do know is the governor has built in a 1.5% teacher range, raise, I'm sorry. But we have been told that the State Board of Ed does not see that going to an across-the-board raise where we would increase our salary table by that amount, but we haven't gotten much more guidance than that. I go to the state spring fiscal conference the end of April and the first 2 days of May. I am planning, I'm hoping I will get guidance on that piece then. We haven't seen our BEP estimates yet. There normally is an April estimate. I'm sure there will be. It's pretty tentative, but it will have the cost distribution factors which can affect our state versus local share of the BEP. It should have the new component cost figures in. So at that point, I should be getting within estimating distance of our BEP funding from the state. Right now, our biggest issue that we're dealing with is staffing Stewart's Creek High. We're still analyzing how many of the students who were rezoned but can stay at their previous school, either because they are rising juniors or seniors, or because they have, juniors, or siblings. And until we know that, we won't know how many teaching positions we will be able to transfer from the feeding schools to Stewart's Creek High.
Did you give the families a deadline to let you know their decision?
Yes, but it's still being analyzed.
Okay, so they've turned their decisions in, if they're staying or not?
Yes.
Okay.
Yeah, but it's a major thing, going back and looking at the schedule at all of the high schools, seeing what teaching positions might be freed up that can be reassigned. And we met with the board on the 18th and went over some very preliminary numbers, and that the teaching positions that we talked there should be more than enough to cover Stewart's Creek High. I don't think that number will be going up. I'm hoping it will be dropping somewhat. It won't be dropping a lot. They're pretty much going to be in line. When we opened Blackman High and Siegel High, we wound up with just over 1,400 students in both of those schools, and we were able to transfer 30-some to maybe low 40 teaching positions. In your core areas, your math, English, science, history, it's a cleaner process because essentially all of the students take those. When you get into the electives, the vocational classes, special education, you're not going to be able to reassign many of those. So those are the areas we are looking at more now, and we have to get into specific schedules for any of those. We have that great unknown. We face a medical insurance increase. We meet on that next week from tomorrow, and then that will go to the insurance committee the end of April, and then be coming forward from there. We met with our consultants a couple of weeks ago and are just looking at trends and getting their input. But we did not have a good year last year in the insurance fund, but this year is looking better. So.
If we could go back to the personnel for just a moment, and I'd just like to know, is this a fair statement that I'm about to make? You probably will transfer perhaps 40 teachers, let's just say 40, from Smyrna, Laverne, to Riverdale, Blackman. And then that will leave you about 70 short of the building?
At Blackman and Siegel, we opened both of those schools, and the vocational technical programs will be one of the big drivers, but we opened Blackman with, I believe it was 93 certified positions, and Siegel High with 88. So
50, 70 range, 50 to 60 range, probably.
Yeah.
And these, of course, will be new to us.
New
teachers.
to us, right. And we also will still have growth, K-8, that we will have to adjust for. With rolling back the kindergarten start date, and I'm sorry, I don't know the details on them. I don't remember the details. I hate to misquote. Our kindergarten class should be somewhat smaller this year, but it will catch up again next year. But first through eighth growth, fourth month was the last month that I had, and we've been holding 2.6% growth period to period, which is right at 1,000 students. So I think fourth period went to 2.6. If we see an increase in the period to period comparison as we go through the rest of the year, that to me is an indication our growth rate will could pick up next year, and that's something I will be looking at carefully. The fifth month numbers I don't think have been finalized. One of the bright spots for us has been this year, because of an audit finding at the state level, we had to move to entirely using the state's student information count numbers for our funding. It used to be we could use our STAR data numbers and input them, and the state got an audit finding for that. And we have gotten that number down, the discrepancy number very low. And we are always going to have some, because you're going to have kids coming and going, kids who are enrolled in more than one system, all that, but we've gotten that to under 20 the last time I saw it, and we had major issues with that at the start of the year. one other minor bright spot we have, which we mentioned, I'll take any of them I can find, which we mentioned last year when the that conservation project for the plumbing fixtures and all that was passed. We have made our final payment on the first energy efficient lighting bill, so that our debt service payments out of GP dropped by $600,000 for that. And another bright spot we had is in our medical insurance, which has been rare for us. As with the January re-enrollment, we are going to have some money left in this year's medical insurance budget. That is one generally I wind up amending money into in the spring, and we will have some money left in that. That's, you know, hundreds of thousands, not a million. But we did have those two bright spots, which I'll claim.
Committee, questions for Mr. Sanvey? I know you're interested in the total budget of the county, of
Right.
course, as all of us are. But your emphasis is on schools, obviously. The school board is aware, I would assume, that we have a lot of things
Oh,
dragging us down.
Oh, of course.
We have a lot of concerns, let's put it that
Oh,
way.
yes.
In a number of various areas
Mhm.
that do not necessarily directly affect schools, things that we're very concerned about.
Mhm.
We are hoping that Stewart's Creek we're going to have some help from the school board on funding and ending fund balance
Oh,
to
yes.
to
And
open that.
again, those pieces are looking good at this point. But I will also say I was much more comfortable when we were having this discussion when we had gone $6 million into fund balance. Last year when we wound up going $9 million, it makes it more challenging to continue that process. Yeah, but I think we should be in decent shape for that. It's hard to say end of March because we still have 3 full months of our operation going. And but several there are areas in the budget that look pretty good. I will be having to amend money into the bus contractor line, but we unless the weather changes or something like that, I should have enough savings within the utilities to cover that with ease. Our budget is looking better at this point this year than it did the last couple of years. We're in good shape on our revenues so far, especially local sales tax. Our BEP growth money comes in 2 installments now, and we get all sorts of disclaimers and they say don't plan on your second payment being as much as your first, because it kind of that final number is the final payment, which we have found out on the day of the July Commission meeting before, is can swing wildly. But our initial payment was I'm within 20,000 or so. I want to say $1,781,000. And if we get that amount, we'll pick up nearly $1 million over budget. But we may not get that. It depends on how the growth is relative to the other systems. And the 6th and the 7th attendance months wind up being 70% of that figure. The 2nd and 3rd, which were all they have based it on, are 35% figure. So we could see some swings there. But I also see some good trends in this year's budget, which will help us in funding next year's.
Thank you, Mr. Sanvey.
Mr. Kevin, I have one question that you may or may not be able to answer. If anything, you may have to just speak from your gut on what you think the pulse is over at the school board. But I'm just curious, if we find budget-wise that we're not in a position to fund all the SROs that have been requested, what's the general feeling? Do you feel like, in terms of, would we be good phasing in, maybe doing
And again, I cannot speak for the school board on that. We haven't had that much discussion on it at meetings I've been at, but often, especially on the Thursday night meetings, I wind up having to leave
Right.
the board and come up to budget committee or commission. So I often miss some of that discussion.
I mean, I know they endorsed
Right.
the
Oh, yes.
recommendation, but I don't hear anybody screaming, we have unsafe schools, because we don't have these
No, I haven't
positions.
heard any discussions
Yeah.
like that.
Okay.
And the board, I really think, does appreciate, and I know it, especially, I think they are aware how much the commission has provided on the capital side. And they realize the stresses and strains, and that the property tax rate is rezoning, for y'all, is rezoning to them.
Right.
But, yeah. We also, though, we continually get hints and warnings of things that are coming down the road for us. One of them is a different assessment method, which would involve more staff that could go in place for 2014-15 on that would, because it would greatly expand kids who might need special intervention.
Certified staff?
Yeah,
Or
because
administrative
it's a certified staff. I mean, we face some things like that. We don't know that there's going to be any additional funding for it's another unfunded mandate to some extent. But they're starting to release details on some of that, and that could be a major shift for us next year. That it won't be lessening what we're doing through the special ed department, but it will be supplementing it and trying to identify and get resources allocated to some of these at-risk children. So, yeah, we're learning all along. But I'm very grateful. We're in our we will be starting our final year of our Race to the Top money.
Awesome.
So that has been a very challenging accounting process for us.
And then how do you measure the results of that?
I'll have to let Mr. Odom address that. I don't think we know enough to say how we
Right.
would measure the results of that at this point, but it does look like we are starting to get more than just rumors. We're starting to get, okay, you need to be thinking this way, that way, but I haven't seen the budget
Right.
impact of any of that yet.
Thanks.
Any other comments, questions for Mr. Sanvey?
Well,
Ms. Cook?
over the years, I have certainly seen the change in county commission and school board. And it seems like that both groups are working very well together.
Oh, I think so, Ms. Cook, yes.
And you know where I'm coming from.
Yes, I do.
And I'm glad to see that.
Mhm.
I'm glad to see unity between
Mhm.
the county commission and the school board, and the other committees that we have too. We're doing real well.
I think we are.
Thank you, Mr. Sanvey.
Thank you, Mr. Chairman.
Appreciate you being here tonight.
Commissioners, glad to be here.
Have a good night.
That brings us to the ever-popular new business. Is there any?
Would you like to accept his report?
Well, was that I guess that was a report. Okay, okay.
Move to accept the report.
Thank you, Commissioner Phillips.
Second.
You saved me there. And Ms. Cook, a second. All those in favor of accepting Mr. Sanvey's excellent report, please say aye.
Aye.
Aye. And there is no opposition. Thank you, Ms. Shelton, very much. Any new business from anyone? Mr. Mayor, comment at all on anything?
No, thank you.
And I think we're probably going to adjourn. We are adjourned.